Welcome to The Health Advocate. I'm Matt Dinsmore and your host of the show, The Health Advocate. We're in series 2 of a 4-week series talking about direct primary care and what that is. If you tuned into last week, you would know a little more about direct primary care as we talked about the 101 of direct primary care from a provider's perspective. And this week, we're actually gaining opinions that matter, and that's from members of direct primary care. We have a patient panel. There's 3 people off to the left. I'll introduce them shortly. Before we dive in, just a quick summary so we catch you up today if you didn't check last week. But direct primary care is a membership-based family practice clinic, which basically means people pay a monthly membership fee to have access to primary care services. Insurance isn't billed. People, when they come to the clinic, are usually rarely billed. You pay a monthly fee and you get primary care services, urgent care services, preventative care services, 24/7 access to a provider through a HIPAA-compliant app and in office, unlimited office visits, no co-payments. There's amazing benefits like this. If you get labs done in-house and procedures done in-house, no additional charging, and your insurance isn't billed for it. It's a very intriguing model that's been taking off over about the past 20 years, especially over about the past 5, and now it's available here in Spokane. So we're trying to raise some awareness in what direct primary care is. I'm going to start by introducing our 3 hosts, and actually maybe we'll just go one by one here. But Daniel, Cobb, I'll start with you. You pre-registered for a direct primary care clinic on the North Spokane like a month before it launched, and so there's not too many people that are early adopters, right, with direct primary care. But you're one of those. So what led you to be an early adopter of a direct primary care?
Yeah, well, thanks, Matt. I am an early adopter in some ways, not every way. But what led me to just jump on board so quickly was I started reading articles about this, and my unique situation was I felt that health insurance was unaffordable for me. So I did some quick math and I figured out, hey, if I go to the emergency room twice in a year, it's still cheaper for me to pay out of pocket.
Yeah.
And if I pay for health insurance, I'm going to be spending, I don't remember what the number was. It was over $10,000 a year. I want to say closer to $15,000 a year for myself and my wife. And I thought, well, shoot, I'm young. I'll just go. If I have to pay for a doctor, I'll pay for a doctor out of pocket. I was doing that for a while. And then I read an article about direct primary care, stumbled onto it on the internet. And I basically fell in love with the idea, realized right away, hey, this is something that is an amazing model that solves a lot of problems. It's not perfect in every way. Insurance still plays a part, but it really solves a lot of problems. And I thought, hey, let me see if this is in Spokane. I'm so excited about this. Mm-hmm. And, I asked around and found out that a clinic was starting, and I knew someone who was related to you and to some people that were starting it. So I said, hey, let me jump on board as quick as possible because I want to see this succeed. Yeah. Not just for me, but also for other people because I believe in what a great model it is.
Next to Daniel is Melissa Berry with everydayspokane.com. She's a publisher. So you are kind of in the know when it comes to Spokane stuff, right?
I try to be. Yeah.
Right, your job partially is to be in the know. How did you get exposed to direct primary care, and why did you decide to make the leap into direct primary care?
Yeah, so great question. So I found out about direct primary care kind of the way that all small business owners do, which is when you leave your job, which is what I did to start my own business, become an entrepreneur, you lose your employer-sponsored health care. And so I was looking around for something, and for a variety of reasons, just the ACA just wouldn't work for me. And so I found Health Sharing Ministries, which is not insurance, but it's very similar to how insurance works, where there's a pool and members submit claims and then you're paid out through the pool. And so when my husband and I moved to Spokane, one thing that I needed was a provider that understood how those health sharing ministries worked. And what I found direct primary care, and it's been really smooth sailing ever since.
Yes. So there's kind of this natural pairing model then between, what did you feel like direct primary care provided? Why do those things work together?
Yeah, so when you have like direct primary care, one thing that I noticed was that it's been really great because you can do all the basic and the preventative and all of that, but of course you always have to kind of have like insurance in the sense if something catastrophic happens. Right. And so it's basically like a high deductible health care plan. So you can think of health sharing ministries as that, or if you're able to get an HDHP, then you can combine it with direct primary care. And so it just like really works seamlessly because like Daniel was saying, my husband and I are young. We don't have anything like crazy expensive, so why not have something like a high deductible health care plan and have direct primary care for like all that preventative of once a year, twice a year, whatever kind of like weird things happen during the year, but just are pretty normal for people our age. And so it just like really worked out together. And then I also read about direct primary care when we moved to Spokane in like November. There was an article online and in the newspaper, and I was like, oh wow, this is like perfect timing.
Wow, very good. All right, and Heather Smeaton, finally off to the left. Now, you're a nurse, which means you might be able to be trusted. I don't know.
A little bit, I hope.
And you worked in the healthcare system, right, an insurance-based system. Now, here you are, right, how dare you, leaving typical insurance-based healthcare and getting a direct primary care membership. Why? Why are you forsaking, all your friends and people and like your loved ones? Is that what you're doing?
No, of course not. Right. No, well, because like they were saying, it's just getting so expensive to have health insurance. And when I left working in an office as a nurse to go home and stay home with my children, I lost that employer portion paid of it and looked into health insurance, and it was astronomical. It was unaffordable for the four of us. It was crazy. So I ended up with a health sharing ministry, but it was also very expensive, and it had a high deductible. And then I actually used to work with Matt, and so we talked about the direct primary care model, and I fell in love with it, and so I'm doing it. It works wonderful. Can I tell some experience of?
Well, let me ask you one more question before we dive into experiences, which is when you tell people like, hey, this is how we're covering our family or how our family is receiving care, do people look at you like confused, or is that true, or they what's their impression?
Yeah, people look to me a little bit confused, and I just have to explain to them it's a membership where you just pay a monthly fee, and then you can go to the clinic. They have same-day appointments, which to me was also wonderful. I can get in any day. It may not be at the exact time I was hoping, but I can get in, or I can at least talk to someone on the phone, or message them, send pictures. If I can't get into the office, and they'll let me know, hey, you should probably go to urgent care, or that's nothing to worry about, come in at 4 or whatever. It's just, I'm sorry, I lost.
Well, so now how does that play out in reality? We know that's part of the services, and I think where you're trying to go with that is, so how actually has it, they claim these things, but how does it play out? How have you utilized it? Have you used their same day access, let's say?
Yes, I have. Because, or like, okay, for one thing, when I needed like a sports physical for my son, who's 12, I was able to get that handled in the same day. Because it was, of course, my son waited to the last minute to tell me about this. And so we were able to get it done that same day so he could wrestle like he was supposed to. It's just, I love the access, the ease of access. I can call and say, hey, is this something that needs to be seen today, or can I wait till tomorrow or next week? Or if I need to, I can say, hey, I need a physical next month. What have you got? I can do the long-term appointments, or I can do a quick appointment. I love that you can do either one. And everyone is so friendly there. When you go in, you don't feel all like, what's going on? There's always smiles, and there's not angry patients in the waiting room or sick patients in the waiting room. There's very few people in the waiting room. Usually it's just me and my family, until there's just not, it's much more streamlined and friendly. It's, I don't know, more user-friendly. I just love it.
Yeah. Melissa, for you, if you go months without using the membership, much like if you were paying for a gym membership, let's say, and you don't go in, let's say you don't utilize these primary care services, do you just feel like that's like, man, that's money down the drain, and just wasted it? I'm gonna talk to him about this weird mole in my back, even though I'm not really worried about it, but I'm gonna use it. Like, I'm gonna use my service. So have you gone months without using it? And when you do you feel, when you look at the bill, do you kind of question, man, what are we doing? Should we not be paying for this?
Yeah, I mean, when we first signed up, I think it was January, I did tell myself, I'm just going to send him all kinds of like weird things that I need checked out or just whatever, because I want to get my money's worth. But it's August, and it's been months probably since I've seen you last, I think. I can't even remember. But it doesn't bother me, because the peace of mind of having you guys, I mean, I'm more like, I use the app that, and I think a lot of direct primary care models have apps, so that way you can like book your appointments and everything. I know that the app is there, and I've had things happen in the past where my husband fell on a nail one time when he was remodeling the house, and we didn't have direct primary care at that time, and it was super stressful and so expensive to deal with. And we talked to you about it, and we knew from you that we could just send you a picture through the app, and you could say, oh, just clean it out and go here to get it taken care of, or come and see me the next day. And so having that ability to have the peace of mind is really totally worth whatever I pay every month, whatever it is for each model there
Sure.
are. Yeah.
It's almost, you have this provider in your pocket, it sounds like, that you can kind of access. Do you feel like it's taken you a while to remember that you have someone in your pocket that you can access all the time? Or do you find that, oh my gosh, I have this service, I'm going to text Matt or text whoever, and
No, I never really forget that I have it. I always know that you're in my pocket or you're in my purse or whatever. I just haven't needed to use it. But last week I felt like I was coming down with kind of something terrible, and I was like, oh. In the past I would stress out. I would call my mom. I would just freak out and just be like, how much is this going to cost me?
Yes.
Who am I going to see? They're going to take 2 months to get me in.
Sure.
But I immediately felt better, because I was like, well, if this turns into something that I need to see Matt about, or I can just send a message and it's no big deal. And then of course the thing went away, because sometimes it's in your head, or you're just feeling down or whatever, but then you feel better the next day, you drink more water or whatever.
Right.
And it was just really nice knowing that I could just contact you right away, see you that same day most likely, and then move on.
Yeah. Daniel, have you felt like there's been limitations in maybe not being part of a larger network of a group, without naming names, like a larger group where the medical records are attaching? Have you felt nailed down to this one clinic and these couple providers? Has that been a barrier or a limitation that you found?
I would say overall, no. However, I'm going to caveat that a little bit. I was in Seattle, and I managed to sprain both of my ankles at the same time. And so there was a downside to that, because, there wasn't some sort of network where I could then go to a healthcare provider right then and there. I will say, though, that I would say that that's maybe a small downside. However, the beauty was I was able to, it was the weekend, I was able to send a text on the app that you just mentioned. And even though it was the weekend, it was amazing. I got a response within probably half an hour. I got a response, even though, the clinic I'm a part of is a small clinic. There's 2 people there. They were able to respond to me, even though I got the message that said, hey, we're closed. If it's an emergency, call this number. I was still able to get in contact with them within 30 minutes, and they walked me through, and it wasn't an emergency. Obviously, if it was an emergency, then either way I would have had to go to a hospital, and so it wouldn't have been covered either way.
Yeah.
But overall, I don't feel that on a daily basis. I did notice that it seemed like, hey, okay, I'm in a different city, what do I do? But the fact that I was still able to get easy access and get advice and get essentially all the help I needed, it didn't end up being a downside, because I was still able to get the care that I felt that I needed at that time.
Yeah. Okay. Well, I was wearing rose-colored glasses here. They kind of seem darker, and so we're kind of bringing up some issues with direct primary care. And so let's shine light on the the good and the bad, so that people who are looking into it can realize what are the limitations, if any. Are there any limitations as we take off our rose-colored glasses that you see with direct primary care, where people really have to consider if this is the right model? Can you think of any limitations?
I mean, I would say like I said, the limitation is if you are worried about, if you're in a different city or a different place, there isn't that network. And I think you kind of set me up for that with your question. That would be one limitation, is if you're constantly somewhere else and you're going to need care in more than one location. I think that could be overcome with maybe potentially a network of direct primary care clinics. I think there's potential for that.
Sure.
I don't know how that would work, but I think that is a possibility where you could work it out with, if you're in 2 cities a lot, you could work it out with them. But that is a small limitation. The other limitation I would see is just if you have super expensive health needs all the time, that are not able to be handled at a clinic. Although there's most things that that I need are, and I've never felt the need to go somewhere else.
Yeah.
But if potentially older people or something, they would need to have something. Probably traditional health insurance might still be the best choice for that, even more than just a high deductible plan.
Yeah.
Right. But for the average person that doesn't have severe medical needs, I wouldn't say that's a limitation.
Yeah. Good points. Anything else?
Well, I've had a couple of surgeries in my past, and so I think about that. That was before I had a direct primary care membership, but I don't know how that would have been, how much it would have costed. It being cash paying, it might have been less, but it may have been more. I can't equate because
Right.
But that's one thing that, like you said, if you have major medical concerns, that you may need traditional insurance, but I just can't imagine that, because I would think when I've talked to hospitals in the past when I had kids, which was a long time ago, there was a discount for paying for cash for things, or paying the bill in full up front. Even when I got a CT scan just like 6 months ago, I got it discounted significantly because I paid for it all that day in cash when I was getting it done. So I can see this as a concern, but I don't really have enough information to say whether or not it would really affect things, if that makes sense.
So your providers aren't going to be, in the direct primary care, are not in the clinic you belong to, are not going to be ones doing surgery on you.
Yeah,
right?
They're not. So I can't say whether or not my doctor would honor like a discount for cash just for not to deal with the hassle of all the insurance.
Right. Yeah.
Which is what I would imagine, being a healthcare provider and having to deal with insurance,
So
I would give you a discount for that.
It kind of points to still having a need for major medical things, surgery, where because the health system is so expensive that you're still vulnerable to
Absolutely.
high bills. If all you have is direct primary care and they can only control the costs within their clinic, what happens when you go outside that clinic and now exposed to costs of God knows what sometimes, like you don't really know until 3 to 6 months later,
you never know.
And so there's that vulnerability. If somebody treats it direct primary care, that's all I'm going to get.
You
they
need
should
something
knowingly,
else,
be taking a risk in that way.
Which also reminds me of another thing. I don't know, are you is direct primary care able to refer out to everybody, or?
Yeah, so from my understanding, providers, they can, their referrals, their lab orders, their prescriptions are still good, right?
Okay.
So they can still write scripts to Rite Aid. Rite Aid can still, you could use insurance and use your insurance to pay for that Rite Aid script, or the lab, or the referral most of the time. There's maybe few instances where referrals might get a little bit muddied, but 90% of the cases, usually, it's still covered under the license of the provider, so you'd still be covered. Yeah.
And maybe I'm still wearing those rose-colored glasses. I never took mine off.
Yeah.
But I guess when I think about it, and Daniel and Heather brought up great points about the specialists, kind of like if you have a lot of need for a specialist or multiple specialists, I think that could potentially be an issue.
Yeah.
But the one thing I've noticed with the direct primary care model, at least the one that I'm familiar with here in Spokane, is that you do have a lot of specialists on referral. I know that I'll get emails updating me about, now we're working with this person doing X and this person doing Y, and if you need a referral for that, come talk to us or send us a message or see us, and we can give you that referral, and it's just as legitimate as coming from a traditional doctor like I used to have, and going to that specialist, except instead of having to come in, pay the copay, maybe get some lab work that costs $100 or whatever, I now just I can text you, or I can text my provider and then see a specialist, and hopefully there's that cash discount and everything. So I think even that's a hurdle that a lot of people think is insurmountable, but I think depending on your direct primary care model, wherever it is you live, then I think it's something that you could overcome.
Yeah. Well, maybe kind of the last question I'll throw out there, and Daniel, you said you fell in love with the model, and Heather said you mentioned that you were sharing with anybody who listened before the show started, and so I don't want to use identity too strong, but it's something that you've bought into, and so when you're talking to somebody, and there's in particularly somebody you begin to share this model for, are there, what makes you want to share about direct primary care? Who does this model work for, do you think, and the people that you're excited to share about?
Well, I personally love it because I have, younger children, and so the ease of access. If someone wakes up with a cough, or, you know, whatever, or they've been coughing for a couple days and I'm not really sure to take them in or not. Because when it's your own kids, your nurse brain just gets lost. And so I can call and say, hey, this is what's going on. These are the vitals or whatever. This is how, here's a picture. He looks kind of green. What do you think? And then I can get advice from there. Hey, you know, come in. We just want to take a look at him. Or he looks fine. Just keep giving him fluids. Like, I just like the ease of access. Or even like I had to get a sports physical and I could just get him in, and it's not, the ease makes me happy. Like, it feels nice to have that doctor in your pocket that you can just text a picture and have to do the whole thing. Because I live outside of town. I live about 25 minutes away from the clinic. So it's a little bit of a drive with the kids. And so I can just send a picture. Do I need to come? Or can we just handle this over the phone? Or if you really want to see him, I'll absolutely bring him. It's just better than having to go sit in a waiting room with a bunch of other sick people. And I like that too, that there's not a bunch of other patients there waiting and they're all coughing on each other, and you're like, why am I coming to the doctor to get help and I'm getting coughed on by all these sick people? But
stay out of the waiting room, sick people.
Yeah, right.
Come on.
There should be 2 areas in those, like sick people over here and the healthy people over here.
Yeah. Oh, you're on something, I think. Yeah. Anything else?
Yeah, I would say my wife actually summed it up really well the other day. We were just talking about it, and she said, it feels like you're their only patient. Like, they're your personal doctor. Like, they have no other patients. And that is actually 100% true. And anytime I share this with people, people are like, wait, hold on. What do you say? Like, back up. So you pay monthly, and then you don't have to pay anything, because everyone is used to paying monthly and then shelling out a ton of cash after just paying, you know, a monthly already. And it's like, well, whoa, this is too good to be true. And I'm like, no, it's not too good to be true. And that's so the financially is huge. It's a huge savings compared to, you know, even if you need to get a prescription written. My wife had needed some medication, and she had to go every other month to the doctor to get a prescription refilled, and we were shelling out $150 just to see the doctor for 5 minutes. That's it. And we waited an hour. We saw the doctor for 5 minutes. They wrote it, and here we are. And so it's like, man, this is about the same cost of that, but all of these other benefits. So when I talk to people, a lot of times people look at me like a little weird at first, like this can't be true, but it is, and it works so well. And you really do feel like you're their only patient. And anytime you need them, they know who you are. You call and you talk to the doctor. You don't have to talk to 3 nurses before, you know, and let me call you back, and you're waiting. And honestly, that causes me, I'm just not going to call unless I feel like my life's in danger. I'm not going to get any care, you know, so things go untreated because I don't want to pay for it. I don't want to deal with it. But in here, anytime I have a concern, I have to remind myself, hey, okay, I guess I can call, even though I feel like I shouldn't, even though I feel like a pansy. I'm going to call anyways. Yeah. And I do, and I'm glad I did.
Yeah, great.
Well, and I have to say, too, as a nurse, that benefit makes me super happy.
Right.
Like, so that, like I was saying, even if there's any concern about anything with my kids or with myself or my husband, I can just call and say, hey, is this a thing? Or, you know, do I need to worry? And it's just such of a more peace of mind. You don't have to wait 3 days for the nurse to get the message to call you back, then 3 more days for the doctor to get the message and call you back, or then he gives the message back to the nurse, and it just cuts the middleman out. I mean, as a nurse, I love that job security, but really, there's no need for nurses in this, which was weird at first, because then the provider takes you into the room, and you start off right away with the provider. They take your vitals, they're asking you questions, they're talking, getting your whole picture. There's not the nurse interpreting stuff and giving it to the provider. I really loved it. It was really weird at first, but I actually really enjoy it now. Yeah. It's really good.
Sure.
Yeah, when I explain it to people on how it works, like the first word I use is refreshing, because it's just different from everything else that we've all, you know, gotten used to, I guess. And then the second thing I describe it is like kind of like your grandpa's like doctor, when you think about how in like the old days or however long ago that was, where like doctors would come to you and they get to know, like you said, they get to know you as a whole person, which is just amazing. You know, like I remember when having to go in and you can only see the doctor for 15 minutes, talk about one specific issue, you pay your copay and you leave. appointment, and then you have to schedule an appointment 3 months later for the second issue you're having. With direct primary care, you see them for like 30 minutes to an hour. You explain everything. They understand like your sleep schedule, your eating schedule, and then like everything else about you that is why you're there. And then the second thing that I love about it is the price transparency. You know, I'd leave in the past, my doctor, get a bill 6 months later, like you were saying, of like several $100s, and I'm like, I don't even remember what I had. It's a surprise every 6 months. But
a good surprise.
Like, surprise! It's never a good surprise, yeah. Which made, you know, planning a healthcare budget pretty, like, stressful, because you never knew really how much I should budget every month out of my, like, family budget for healthcare. Now, when I see you guys, you know, I know my monthly pay and how much I pay monthly, and then I know, like, lab work and prescriptions, and, like, all of that's ahead of time, and it's all, you know, cash pay, so it's significantly cheaper than it ever has been for me in the past, and it's just really refreshing, like I said, to know what you're going to pay and know your doctor. Go figure.
Yes, refreshing. Very foreign nowadays, unfortunately.
Yeah.
Well, I want to thank our member panel for joining us and giving us patient perspective and insight on to how direct primary care works and the benefits and the cons and all that good stuff. Stay tuned with us next week as we head into week 3, and we'll be talking an employer's perspective of direct primary care and how some employers locally have purchased memberships on behalf of their employees to add it as an employee medical benefit. Kind of interesting. We'll be tuning in next week at that, and then week 4 we'll be talking to healthcare brokers, insurance brokers, and getting their perspective on direct primary care and who it might work for and who it may not work for. Appreciate you watching this far, if you have, on Facebook or YouTube or however you're tuning in. My name is Matt Dinsmore with the Health Advocate, signing out.
Ask the host a question, recommend a guest, or hear this program again on Facebook, YouTube, Twitter, Apple Podcasts, Spotify, or SpokaneTalksMedia.com.